Kate Jones, what does the Reiki Council do?
Well, one of the things that the Reiki Council has been doing over the recent years is to bring together lots of different branches of Reiki so that we could talk together about the standards that are needed for people who are working with giving treatments to the public.
And was there a great need for this?
There was, because before the Reiki Council started, the different schools of Reiki were all kind of doing their own thing, and some of them were going off in different directions. So what was really good was to bring people together and start to really talk together and share our understanding of Reiki so that there was more cohesiveness really in the practice.
And does that still allow some organisations to go off in different directions, as you put it?
Yes, we totally respect that there are differences between the different styles of Reiki, but what we are really clear about is that there are some things that people who are working with the public need to be doing together. You know, they need to be maintaining certain standards. So.
And that's important if you're going to work within an integrated health setting, that you do have these standards.
Exactly. If we're working in an integrated setting, it's so important that we can be trusted as practitioners. And in order to be really trusted, it's good if we have common standards.
And how does Reiki benefit people in an integrated health setting?
It benefits people in many different ways, but in particular, for example, it's helpful for reducing pain. It helps people to feel more relaxed, which can also help with their pain experience. It helps people to be less anxious, and certainly it's known that when people are less fearful and have a positive mindset, they tend to heal better. So it can actually help for conventional treatments to work even better and people to recover more quickly.
Give me some hard examples of where Reiki is being used in an integrated health setting.
It's being used at University College London Hospital. They actually have a Reiki practitioner who's employed in the oncology department there. And I understand they're also using Reiki to treat women who are suffering from endometriosis, because it helps a lot with their pain. It's also used in drug and alcohol addiction recovery. There was in Australia many years ago, in 1992, a project was set up to help recovering addicts with Reiki. And out of this has grown an understanding of how much it can help people who are recovering from alcohol and drug addiction.
Do you think that people in general realise just how great are the benefits of Reiki?
I think it's a kind of quiet revolution that gradually people are realising. I think often when people have experienced Reiki for themselves, they understand how beneficial it can be. But I do understand that people are still quite wary of something that seems to be so out of the ordinary in some ways. There's not a lot of clinical research about Reiki yet because it's still quite new, especially in this country.
And is there clinical research going on?
There is, yes, there is. Most of it at the moment is in America, which is where Reiki has been practiced for longer than in the UK. But certainly, you know, there are studies that are beginning in the UK, and there's a real interest in showing people how effective Reiki can be.
In an ideal world, how would Reiki fit into an integrated health system?
I think Reiki would be really beneficial alongside conventional treatments, alongside conventional medicine of all sorts, yes, because it can help to support medical practice. It helps, for example, it helps wounds to heal more quickly, it helps pain to be reduced, as I said, and it can enhance and helps people to feel more relaxed and at peace with their treatment. And also at the end of life, Reiki can be helpful to help people be more peaceful as they face their end.
Generally, do you feel that you bridge the divide between alternative healthcare and more traditional healthcare?
I would say that we're more complementary than alternative. We don't diagnose, and so it's really important that there are other medical practitioners who are doing that. What we do is to support people in their healing path, if you like. So I think it's something that's still evolving, and we are also hoping to help practitioners to move into more integrated settings by offering some assessment service or evaluation of their skills.
What are the key achievements of the Reiki Council, and what future plans do you have?
Well, we got involved in developing national occupational standards for Reiki practitioners, which was revised a couple of years ago and has now become part of the complementary and natural healthcare national occupational standards. We've spent several years working on developing a core curriculum to help Reiki practitioners move into public practice, working with the public. We've developed a code of ethics, guidance for grandparenting, continuing professional development, which are all now published in our Reiki Resource Handbook, which has just been published.
Just out?
Just out, yes. We also have our website, which is where copies of this can be ordered, and we're continuing to try and support people working with the public with Reiki over the coming years. We're hoping to develop an evaluation service to help people understand what further training they may need in order to be really competent and trustworthy practitioners.
So no resting on laurels?
Definitely not.
Kate Jones, thanks very much indeed.
Thank you, Martyn.